Did you know that complications after a liver transplant can significantly impact patients' quality of life? It's true. These complications, which typically arise within the first year following a transplant, can affect not only the patient's quality of life but also increase morbidity, mortality, and healthcare costs. It's crucial, therefore, to understand and address these complications promptly and effectively. Now, when we talk about these complications, we can group them into several categories. These include problems with blood vessel connections, issues with bile duct connections, complications arising from underlying medical conditions, or side effects from medications. Each of these categories presents its own set of challenges that require specific medical attention and care. Blood vessel connections, for instance, are as important in a liver transplant as hooking two garden hoses together to allow the water flow. But complications can arise, causing narrowing or kinking of these blood vessels. Now let's delve deeper into some of these complications. Imagine hooking two garden hoses together. That's how crucial blood vessel connections are in a liver transplant. These intricate connections allow blood to flow between your body and your new liver, like water through those garden hoses. However, like any connection, things can sometimes go awry. The blood vessels can narrow or kink due to handling or positioning during the transplant. This can be likened to a garden hose bending or twisting, slowing or stopping the flow of water. Now let's talk about bleeding. It's a common occurrence during a liver transplant, kind of like how you might have a little water leak when connecting two hoses. In some cases, this bleeding might not be a minor issue and may require a return to the operating room. Surgeons may need to fix the source of bleeding or remove blood clots that have formed. It's important to note that liver disease itself increases the risk of bleeding. This is because the liver produces proteins that help your blood to clot. So when you have a new liver, it might take a bit of time for it to start functioning normally and producing these important proteins. Another crucial aspect of a liver transplant is the connection of the bile ducts. These are like the smaller hoses branching off the main garden hose, transporting bile, a fluid produced by the liver to aid digestion. Complications can arise if these connections are not functioning properly, which can lead to problems post-transplant. Blood transfusions are common during and after a liver transplant, but the risk of complications from these transfusions varies. It's not a one-size-fits-all scenario. The risk depends on other medical problems you might have and your overall health. In the end, it's all about knowing the potential complications and being prepared. Recognizing the signs of these complications early can make all the difference. Dealing with them head-on can significantly impact your quality of life and long-term health after a liver transplant. The risk of complications varies based on other medical problems and the patient's overall health. Liver disease increases the risk of bleeding as the liver produces proteins that help blood clot. This statement rings true, especially in the context of liver transplants. The liver, in its essence, is a vital organ responsible for various functions, including the production of clotting proteins. These proteins are essential in preventing excessive bleeding, a common complication following a liver transplant. When you've undergone a liver transplant, your body is introduced to a new organ. And just like any newcomer, it may take a while for the new liver to get accustomed and start functioning normally. During this transition period, the risk of bleeding is heightened due to the diminished production of clotting proteins. This scenario, coupled with the inherent risks of invasive surgery, makes bleeding a common occurrence post-liver transplant. And here's where the role of blood transfusions comes in. Given the risk of bleeding, blood transfusions are a common sight during and after liver transplant procedures. They act as a life-saving measure, replenishing the lost blood and ensuring that the body's oxygen supply is not compromised. However, it's essential to remember that the risk of complications from a blood transfusion varies. It's not a one-size-fits-all situation. The risk is influenced by a variety of factors, including other existing medical conditions and the patient's overall health. For instance, patients with a history of heart disease may face a higher risk of complications from blood transfusions. Moreover, the medications prescribed post-transplant can also contribute to complications. While these medications are crucial for preventing rejection of the new liver, they can sometimes lead to side effects. These can range from mild symptoms like nausea or diarrhea to more severe ones like kidney damage or high blood pressure. So it's clear that managing post-liver transplant complications is a delicate balancing act. It's about ensuring the new liver acclimates well, preventing excessive bleeding, managing potential medication side effects, and maintaining the overall health of the patient. But what happens when complications develop slowly over time? This question takes us to our next segment, where we'll delve into late hepatic artery thrombosis, a complication that develops gradually post-liver transplant. Stay tuned. Late hepatic artery thrombosis can develop slowly, allowing vessels to form collaterals for adequate perfusion. This is a fancy way of saying that your body can adapt to changes in blood flow to the liver, but it's not something we can always rely on. In some cases, this condition can lead to serious complications. Now, one of the strategies that doctors might use to manage this complication is a procedure known as a partial hepatectomy. This involves removing a portion of the liver, depending on the severity and location of the thrombosis. It sounds a bit drastic, but remember, the liver is one of the few organs in your body that can regenerate itself over time. So while this might sound like a major operation, it's a calculated move to ensure your overall health and well-being. But here's the kicker. Prevention is always better than cure, and that starts with recognizing the danger signs of rejection and infection. These are two of the most common complications that can arise after a liver transplant, and they're not to be taken lightly. Rejection is when your body's immune system sees the new liver as an invader and starts to attack it. This can be a bit tricky to spot, as the symptoms can be quite subtle. You might experience a fever, feel some discomfort in your abdomen, notice that your skin and eyes are turning a bit yellowish, or see that your urine is darker than usual. Infections, on the other hand, can occur when harmful bacteria or viruses take advantage of your weakened immune system post-transplant. The symptoms can be similar to those of rejection, with the addition of things like chills, sweats, or a persistent cough. These symptoms are your body's way of waving a red flag, telling you that something's not quite right. And it's crucial that you heed these warning signs and seek medical advice immediately. Being proactive in monitoring your health post-transplant is crucial. Remember, you're not alone in this journey. Your medical team is there to support you every step of the way. So don't hesitate to reach out to them if you notice any changes in your health. After all, it's better to be safe than sorry. Rejection and infection are the most common complications post-transplant. After a liver transplant, your body may see the new organ as an invader and try to reject it. This can happen at any time, but it's most common within the first year of the transplant. On the other hand, infections are a common risk because of the immunosuppressant drugs you'll need to take to prevent your body from rejecting the new organ. These medications can weaken your immune system, making you more susceptible to infections. Now let's talk about how we can identify these complications. Monitoring your blood work plays a vital role in spotting signs of rejection. Fever, abdominal discomfort, jaundice, and dark urine can all be signs that your body is trying to reject the new liver. If you notice any of these symptoms, it's crucial to get in touch with your healthcare team immediately. Infections can present in many ways, but common signs include fever, cough, shortness of breath, or feeling unwell. Again, early detection is key, so if you're feeling under the weather, don't hesitate to reach out to your medical team. Modern medicine has given us some great tools for early detection of these complications. Diagnostic procedures such as ultrasound and CT scans can spot potential issues before they become severe. Ultrasounds use sound waves to create images of the organs inside your body, while CT scans use X-rays to generate detailed cross-sectional images. Both of these procedures are non-invasive and can provide your medical team with valuable information about your liver's health. In summary, rejection and infection are two of the most common complications after a liver transplant, but with careful monitoring and early detection, they can be managed effectively. It's essential to stay vigilant for any signs of trouble and to keep in regular contact with your healthcare team. Remember, staying vigilant can be a lifesaver. While we've touched on predictive models for complications, it's crucial to remember that each patient's journey is unique. Post-liver transplant complications, from vascular to biliary and beyond, are not uncommon. Most occur within the first year after the procedure. These complications can significantly impact not only the quality of life, but also increase morbidity, mortality, and healthcare costs. It's important to understand that potential complications can arise from various areas such as blood vessel connections, bile duct connections, medical conditions, or medications. Recognizing the danger signs of rejection and infection is vital for a successful outcome. Regular monitoring and diagnostic procedures like ultrasound and CT scans can help detect potential issues post-transplant. Addressing these complications promptly and effectively is key to improving patients' lives post-transplant. That's all for today's video. If you found this information helpful, don't forget to subscribe to our channel for more health tips and updates. Hit the subscribe button below and turn on notifications so you never miss out on our latest content. Thanks for watching, and we'll see you in the next one.